Taoiseach, there's been a lot of pre-election promises made in recent days. Again, the Minister for Health has been at it with regard to outlining his vision of the health services in the years ahead. And I suppose it is to camouflage the fact that the previous pre-election promises of 2011 haven't been fully honoured. In fact, the vast majority of them have been shredded and totally ignored. And just in the context of a speech that the Minister for Health made recently to the Chartered Accountants, where he effectively was outlining the end of the public health services as we know it, he said he's strongly of the view that the hospital groups or trusts, if you would like to call them that, should have authority and freedom to make collective agreements, manage their own assets and payroll, and negotiate independent contracts to recruit managers and specialists outside of the constraints of public sector rules in the way semi-states do now. He then added, to make things worse, by illustrating that where these trusts, hospitals consistently underperform in terms of clinical outcomes, patient experience and financial management, it should be open to the provider to transfer management of the hospital for a period of time to private providers by means of a concession or management contract. Now, Taoiseach, there is a strong attachment to the public health service in this country. It is under-resourced, it is underfunded, it is facing huge challenges and difficulties in trying to provide basic levels of service, and that is primarily down to lack of resourcing. We've had week in, week out an illustration of that in our emergency departments across the country. We have consistent increases in outpatient and inpatient waiting lists on a continual basis. But I think it's important, Taoiseach, that you, at least towards the end of this government, would outline whether or not Labour are in cahoots with the tax-right policies of Minister Varadkar in terms of privatisation of large tracts of our public health services. So basically what I'm asking you, Taoiseach, is are you in agreement with the concept of farming out our public health services to private management companies, establishing something like an Irish Water that's to be managed by an accountancy firm that will not take into account the social need and the social aspect of our public health services? So, Taoiseach, can you today dissuade the fears and the concerns out there that our public health services could be and would be handed over to private management companies in the years ahead if Fine Gael and Labour are returned to government?
Taoiseach.
Well, first of all, I understand the speech that Minister Varadkar made was in the context of an address to the Institute of Chartered Accountants. So I suppose if he was talking to accountants, he may well have addressed the issue of accountants' roles in the various elements of the health services. I think Minister Varadkar was very clearly giving a personal view. And in fact, I think he indicated that, and that these were his wide-ranging thoughts on how the health services might develop as he saw it. I think he's done that. You know, I think it's one of the things that people find very attractive about the Minister, that he does engage in very broad-ranging discussion on his views. He did that before the last election. Presumably he's doing it now before this election in relation to a variety of areas. So you're asking me, do I agree with what he has to say? I mean, first of all, I welcome the fact that he's speaking broadly about his own views and setting them out and giving great thought to his views. It doesn't mean, though, that anybody has to particularly agree with any or all of his views, but it's a free country with free speech. And in that context, I welcome debate about the future of the health service. But in relation to my own views and the Labour Party's view, our view in relation to the health service is rooted in the concept of an organised, efficient, effective and caring health service delivered for the most part through the public health service, and delivered, as has been done for centuries in this country as well, as you'd be familiar with not-for-profit institutions, many of them religious in our origin, which have provided care and health services to generations of Irish people over the centuries. So that's where our vision of the health services is rooted. Now, we did inherit, Deputy, your vision of the health services, which was the construct of the HSE. And it would be fair to say that when Fianna Fáil were in government, round about 2004, I think you ran away from the responsibility of holding the Department of Health and the senior ministry that involved. And I think from there on out, you actually allocated that particular portfolio to your partners, your then partners in government, who certainly had a very strong view of the role of the private sector in the health services. And you, in fact, in your budget statement this year, and you referenced the ED crisis, but in your pre-budget statement, Deputy, I actually didn't see you proposing, or Fianna Fáil proposing, to allocate the kind of additional funding that this government has actually allocated. So, you know, we're all involved in a debate, and I wouldn't exclude your party from being involved in that debate. You have a particular history in relation to the HSE and what you were trying to achieve in the health services. But we do have a health service in this country which comes, as I said, with a very, very strong public service ethic. It's really important that we maintain that to the highest degree. We also have inherited a whole sector of the health service which is not for profit, much of it originating with religious organisations and bodies in this country. And I see the health service and the core of the health service essentially being provided through, as I say, dedicated public service which puts the patients first. We do have a problem about, as we recover, allocating sufficient resources to meet all of the demands of a growing population and growing health service demands. But every country in the world, but particularly in Western Europe, faces that challenge, and that's a challenge that the Labour Party in this budget has helped to address, together with our partners in government, Fine Gael, by allocating very significant additional resources to health services in Ireland.
Deputy Billy Kelleher for a supplementary question.
Taoiseach, certainly with regard to running away from obligations, you ran away from all your obligations. You promised that you would protect the vulnerable. You promised that you would protect those that most needed support from the state. And in every budget that you supported in this Parliament for the last 5 years, brought forward a tax on the most vulnerable in this society. So the idea that you can stand up here and say that we were running away from health simply is a farce.
Please.
You are directly responsible.
Deputy.
You are directly responsible.
Please.
And let me say, Minister, you're directly responsible. You're directly responsible for the thousands of people who are in emergency accommodation on a continual basis for your reluctance to address the rent supplement and the need for an increase. But getting back to my original question.
Deputy.
Bernard.
Deputies. Please. Deputy Kelleher has the floor now, please. Deputy Kelleher.
Getting back to my original question of the privatisation of the public health services, the Minister for Health was speaking at the Chartered Accountants. Now, just because you're speaking at the Chartered Accountants doesn't mean that you should tell them something that they would be interested in, because I would be very concerned if we were handing the running of the health services over to the KPMGs of this world. The bottom line, it is a public health service, and I'd like to know whether you are committed to retaining a public health service. In other words, it is retained in the ownership of the public and it is run for the public. And the idea that you can say it was just a speech that was being put forward at the Chartered Accountants. The bottom line here, Taoiseach, is that Minister Varadkar did outline his vision of the health services in the years ahead. And he has also outlined the fact, along with Fine Gael and yourselves, that you are going to put yourselves as an outgoing government before the electorate. Now, we'd like to know whether you support the concept of privatisation of our public health services. And I know that you have praised the Minister, and obviously he's a constituency colleague, but leaving that aside, you need to accept that there is huge concern out there simply because our public health system is underfunded, it is under-resourced, it is continually starved of the resources it needs to provide basic services. And that has been highlighted time and again. And are you saying now, Taoiseach, are you now saying, Taoiseach, that you are supportive of the concept of handing the management of hospitals over to private companies and undermining the public health service?
Thank you, Deputy. Taoiseach to reply.
Well, I actually forgot earlier to say, Deputy, in the context of this government, I want particularly to congratulate people in your own constituency for the really good announcement by Apple yesterday of 1,000 extra jobs in your own constituency in Hollyhill. And I know that both Minister Kathleen Murphy, Minister Kathleen Lynch, Minister Darragh Murphy will be very pleased about that. So in the same way that you probably have a very positive relationship at local level with those ministers of this government, I'm sure you do welcome the Apple announcement. It's a great announcement for the north side of Cork. But it's what this government, well no, you threw out a general thing about the government. The government is doing what it promised to do, which is to restore the economy and get people back to work. That's the #1 job of the government. And by the way, this year in the HSE, we're employing overall about an extra 4,000 people in the HSE, which is the first significant recruitment that has happened. My vision of the health service, the Labour Party's vision of the health service, is a publicly funded, well-run health service. Bearing in mind as well the long not-for-profit voluntary health tradition and service tradition that also exists in this country. I don't know whether you want to see the back of that, but the Labour Party does not want to see the back of the huge contribution that the voluntary sector and the not-for-profit sector has made to the development of health services in this country. So that is a very, very important role. And I don't know whether Fianna Fáil are now saying they're going to shut down on all of that. But I want to say, and I mean, I see you referencing chartered accountants there. I have to confess, I'm originally a chartered accountant myself, and all I can say is that, like lots of other professions, chartered accountants have a wide range of views on different issues. The Minister was speaking, and I think it's to be welcomed. He was speaking in a broad way. He wasn't talking about government policy. He was not talking about government policy. He was talking about his own thoughts on and views on how the health service should develop. It would be really good if we could hear any views whatever from anybody in Fianna Fáil, because since about 2004 all you've done is run away. And by the way, as you know, the funding for health has expanded very significantly in this budget for next year, and the funding being committed to health this year has expanded very significantly. Yes, we have serious problems that have to be addressed, and we are addressing those problems by funding them.